And we're here this afternoon to hear from you about your concerns about COVID-19 and its effects on Clackamas County. This is the first of 2 town halls this month. The second one is next Monday, December 14th, for Spanish-speaking residents, beginning at 4 o'clock. You have multiple ways to communicate with us today. You can use the raise your hand feature on the top or the bottom of your Zoom bar, or you can dial *9 if you're joining by phone. And you can always email us at clacconews@clackamas.us. We'll begin today by explaining the latest information before we get to your questions and comments. Let me introduce Clackamas County Commission Chair Jim Bernard. Chair Bernard.
Thank you, Kimberly. During this ongoing pandemic, the Board of Commissioners have prioritized staying directly connected with our residents and stakeholders. Since March, we've held at least one digital town hall or listening session every month. We continue to get lots of participants. Today, we have 43 so far. I'd like to thank everyone for joining us today and digitally during the last year. Your comments, opinions, and experiences have been invaluable to us as we take action. The pandemic has been very hard on every one of us. We recognize there are those struggling with job loss and the economy, with health issues, and with depression. We've had listening sessions on all these subjects, and we hear you. Today's topic is COVID-19 and reopening Clackamas County. Do you have any questions or comments about how COVID is affecting our community? We want to hear from you. We're all interested in when we will be able to open businesses and safely gather with our family and friends. Today, I'm very happy that the Clackamas County Public Health Officer, Dr. Sarah Present, is joining us to help answer questions and provide an update on where Clackamas County stands. The entire board and our community is very fortunate to have Dr. Present with us during this entire pandemic. She continues to provide the commission with key information, and we help guide our community. My fellow commissioner and I turn to her for information that helps us safeguard the lives of our residents to the greatest extent possible. And I'd like to thank her now for her outstanding work. Thank you, Dr. President. To those joining us, please know that we will respond to as many questions and comments as we feel we can, but mostly we're here to listen and to hear from as many people as possible. So if we don't respond to your questions or comments, please don't take that as a sign that we don't care. We do care. And with that, I'm going to turn it over back to Kimberly. Thank you.
Thank you, Chair Bernard. Next, our County Public Health Officer, Dr. Sarah Present, will provide you the latest on how the pandemic is affecting our county. Dr. Present.
Thank you so much. I'm really honored to be here today. I'm really honored that I get to represent our public health department in Clackamas County and help lead our response to this pandemic in Clackamas County. Again, my name is Dr. Sarah Present. I'm the public health officer for Clackamas County. I'm also a deputy Tri-County health officer, so I work closely with Multnomah and Clackamas County Health Officer Program. Also, I'm a family doctor and I work at our Clackamas County Beaver Creek Center as a primary care practitioner. Kimberly, I have a few slides to show. Are those good? We'll get those pulled up. Thank you. I have so much gratitude for being able to be in this position that I have to give information to you, to our commissioners, to our county staff, and to you in the public of Clackamas County. I also have a really tough job, especially during times like this, of giving sometimes difficult and often very scary news about what's happening. But I also have the honor of being somebody that can say with confidence that there is hope. There is an end in sight. We will get through this. We will continue to bond together as a community and make it through this, and it will end someday. I just want to give all of you reassurance and hope that we will make it through. We have learned so much through this pandemic about how to adequately serve our community and reach our vulnerable populations and reach various parts of our community, including people with different understanding, different ideas about how to do this. But I know that when we work together, we make good things happen. So right now, we are in a unprecedented surge of the COVID-19 pandemic in Oregon and in Clackamas County. So this is one of those times that I have scary news to give. People may have been following the data. If you want to go on to the next slide. There have been a total of 88,287 total cases in the state of Oregon and over 1,000 deaths. 7,626 cases in Clackamas County, and unfortunately 94 deaths due to COVID-19 since the pandemic began. You can see on this slide our weekly case rates through this last Monday. And you can see the steep climb in cases that we've had since the end of October. There may be a flattening out in the last week, but we are still waiting to see all of the repercussions of the Thanksgiving holiday. But with this flattening out and potential decline, I am hopeful that many people heard the words that we are having trouble, that cases were going up, and took the precautions that were necessary during the holidays to decrease spread. We are also seeing an increase in hospitalizations, and we know that our hospitals are strained, but there are still beds available, and we are holding steady. And for that, I thank all of you. If you'll go on to the next slide, please. So the Oregon Health Authority and the state of Oregon have changed from reopening phases to a risk and protection framework for business and for what businesses can be open in the state of Oregon at various times. The metrics align with the school metrics, which are governed by a different entity, but they are the same numbers that we're looking at as far as reopening schools and reopening various sectors of our economy. We're looking at two metrics to determine what level of risk our county is in: the number of cases per 100,000 people and the percent positivity. And these are both over a 14-day period. So I will show you in a moment, but there are four risk levels: minimal spread, moderate spread, substantial spread, and extreme spread. Extreme really means that there's widespread transmission of COVID-19 throughout the community, with lots of sporadic cases and lots of spread that is not controlled. And that would be with more than 200 cases per 100,000 population over a 2-week period. If you go on to the next slide, please. Currently, as of this last Monday, Clackamas County was well into that extreme spread category with nearly 455 cases per 100,000 population. And our percent positivity is lower than 10 at 8.3, but it's really a one or the other that will keep us in this risk category. And with the numbers of cases, this is where we are now, and for several weeks to come at least. Go on to the next slide, please. A full list of what can be open and what is not open at the various levels of risk can be found at the Oregon coronavirus webpage at oregon.gov/coronavirus. But in the extreme risk category, indoor dining at bars or restaurants is not allowed. Outdoor dining is allowed at limited capacity, and pickup or takeout only is encouraged. Home gatherings, we really continue to encourage you to stay home, limit your gatherings to no more than 2 households and no more than 6 people. Again, you can find this full list online at oregon.gov/coronavirus. Okay, go on to the next slide, please. So we know that the vast majority of COVID-19 cases are actually mild. The majority of people are not going to be hospitalized, and the majority of people will not die from this disease. Many people have mild disease. However, many people have severe disease. Like I said, Clackamas County alone has had nearly 100 deaths from this disease, and we want to prevent every single death that we can. We know that even if you yourself are not at increased risk of getting severe illness from this disease, you are still at risk of spreading it to your loved ones or others who are at risk. The majority of our cases have been in younger individuals, and this is consistent with data across Oregon and the country. 20 to 30-year-olds make up the majority of our cases, and the numbers also increase over 80. We also know that those over the age of 65 have the highest risk of having severe complications, and many people within those age ranges have underlying conditions that increase their risk of complications. So the people who are getting the most disease may not be the ones who have the highest risk, but we all need to remember that we all interact with others in our life that are at risk, and we need to do everything we can to protect our community and our loved ones. Next slide, please. This is a look at complications amongst people with pre-existing conditions. We know at this point, after nearly a year of this disease, that people with cardiovascular disease, meaning heart disease or vascular disease, are 5 times more likely to be hospitalized than those who don't. People with chronic liver disease are 4 times more likely to be hospitalized than those who don't. Other chronic conditions such as smoking, hypertension, greatly increase your risk of hospitalization. And many people have these underlying conditions that put them at higher risk. So again, even if you may not be at risk, people in your life are. So we need to do what we can to protect them. Next slide, please. Similarly, we have seen large disparities amongst ethnic and racial populations. In particular, the Hispanic population, the Latinx population, makes up 8% of the total population of Clackamas County, but has made up 20% of the COVID-19 cases. And we know from national and local data that people of Latinx descent are also more likely to be hospitalized or have severe disease. So again, while you may not be at risk, people in your life may be. All right, next slide, please. So we have been, as a public health system, trying to spread news of the risk of the increase in cases and acknowledge that this is a really hard time to have increased restrictions on what we're doing. We are in the dark times of winter. Thanksgiving, the winter holidays are all times that we typically gather together and celebrate finding some lightness in the dark times. We still want people to be able to do that while taking some really strict precautions to prevent continued ongoing uncontrolled spread of COVID-19 in Clackamas County. So during this holiday season, try to think of 1 or 2 things that are the most important to you and see how you can maintain those traditions and those activities at a way that is as safe as possible. Dedicate yourself to limiting the risk to yourself and others doing just those 1 or 2 things. Really minimizing your exposures for before and after you get together with people outside your household, if you choose to do that. And talk with those that you're getting together with about what your risks are, who else you've been seeing, so that everybody can know and trust that you will share with them and they will share with you if anybody does get diagnosed with this disease and if there's potential spread. Open conversation and transparency about risks will help us all make the right decisions during this holiday season. Next slide. We have many resources, both for individuals who are concerned about their own risk, people who have been tested for COVID-19, people who have questions, for businesses, for all sorts of, we have lots and lots of information. Please go to clackamas.us/coronavirus to find more. Thank you, and I will finish there.
Thank you, Dr. President. We are now ready to take your questions, and you have multiple ways to communicate with us today. You can use the raise your hand feature on the top or the bottom of your Zoom bar, or dial *9 if you're joining us by phone. You can also email us at clacconews@clackamas.us. We have until 4:30 or whenever we run out of questions. We also have several emails from you that we will also read to the commissioners as we take the question, in between questions that we take. So again, you can use the raise your hand feature to speak directly to the commissioners. We do have one already from Jennifer Harding. Jennifer, if you could please unmute yourself and tell us where you are from and ask your question.
Hi, my name is actually Terry Gilreath, but I borrowed Jennifer's iPad, so same business. Thanks for taking the question and thanks for hosting the meeting. I'm a co-owner with Jennifer Harding of Eastside Athletic Clubs. We have 2 locations in Clackamas County. We have been in existence in that county for over 40 years, serving 4,500 members and employing 100 staff people. I guess my question is twofold. One is I'm hoping that Clackamas County can go to bat for some of us, what I would call small businesses that have been community supporters, winners of Chamber of Commerce awards over the years, et cetera, Special Olympic sponsors. We've been shut down yet again. First time was for 6 weeks and now 2 different in a row. And we don't know what the future is going to hold on Monday. Again, 100 staff being laid off, no assistance from unemployment. Been here a long, long time, and this is becoming very painful. I don't know if we'll be able to move forward or not. So I'm looking at Clackamas County, and we've been there all the time for Clackamas County, and I think a contributor, and we'd like to know what the county itself is going to do about the $55 million that are coming through the state funding to help small businesses like ours. And then secondly, to kind of start raising their hand and their power to say, how is Governor Brown picking winners and losers in this pandemic? We've had 56,953 check-ins at our own 2 facilities since June the 1st. That's 57,000 check-ins and not one COVID case traced back to our athletic clubs. So I don't understand Governor Brown's rationale for some businesses are shut down and some businesses are not. The University of Oregon put out a third-party study. It was just released today. I'll be reading that tonight and forwarding that to all of our county commissioners so that they can get their eyes on that. It specifically talks about health and fitness organizations, what they do for the community, and that the case tracing is showing 0. So how do we get some of that $55 million and keep people healthy? Exercise is medicine, and I don't understand how we're picking winners and losers. I need the county to come to our rescue on this, or we won't be around much longer. Sorry for the long statement, but how do we go after some of that money?
Anybody? Paul?
Yeah, I'll take that. So thank you, Terry, for your comments. And I understand that we've been communicating by email here and there. So I appreciate everything you've done on behalf of the community, and give my best to Jennifer as well. I will say that even this morning at our business meeting, we actually talked about the remainder of CARES Act funding. I hope that you applied for that in this latest round through the chamber or through our county staff. I know it came up at North Clackamas Chamber, and I know that you are a member of that. But I asked for a breakdown and find out who, number one, who has applied, and also what types of businesses have applied for that remaining amount of money that we've got allocated for Clackamas County for business assistance that we have to spend or distribute before December 31st or by December 31st. So there is some money. I don't think it'll be necessarily significant. I don't know exactly how the apportionment's going to go, but we're keenly aware of that. And that, again, that was a topic for this morning. So as far as the going to bat, I know that we have communicated and discussed this every week. We discuss this twice a week, Tuesdays and Thursdays. We have conveyed our concerns to Chair Bernard. Chair Bernard has conveyed those concerns to the chairs of the 3 counties and also to the governor's staff and herself. And at times I feel it falls on deaf ears. I think we're all in a learning curve. I understand the need for us to be cautious and to keep public health in mind. And when we took the oath of this office, we also took the oath of office and the responsibilities that we inherit as the Board of Health. So with that, we have a tremendous amount of responsibility, and at the same token, very little control. of setting these regulations. So I'd love to see the study you just cited, the OSU, and I'll be looking for that. Was it OSU or PSU or OHSU? I'm not sure what you said, but I'll definitely be looking for that.
That other university. Well, you know, we do often talk to the governor or governor's staff at least once a week, and the governor probably every other week. She gets her information from her professional staff, where they get the statistics and what they do, how they determine what stays open and what doesn't. I have no idea, but I'm sure that it's not just a dartboard on the wall. We know that, well, for the grant funding, I think I heard 3 million that Clackamas County got today. The sad part is, frankly, that when the federal government CARES money came, Multnomah, Washington, and the city of Portland got big hunks of money and we got none. So because of that, we've had a lot less to distribute. But when we do get it, we do have grant programs, which I'm sure you can go to our website and click on COVID and probably get to the grants, but maybe Kimberly could give you a little more information on that. But I know that we just got some money that needs to be distributed before the end of the month. So keep an eye open. Kimberly, do you have any information on that? You're on mute.
Apologies. We will get that pulled up during this meeting and provide that information, but we do have a lot of information on our website at clackamas.us/coronavirus. We have a section for businesses. We also, in our news section on just December 7th, we have information about business recovery centers that have just opened for businesses to go seek that technical assistance and other types of assistance that they need during this difficult time. Again, thank you for your comments. We would still love to hear from more of the attendees present today, and you could do so by using the raise your hand feature on Zoom. In the meantime, we will share a few emails before getting to our next caller. And we have one, it's more of a comment. It is from Ann Walker Consulting. And she just writes, or they write, please open gyms with the same spacing requirements as Fred Meyer. So not fair. We have Rick Peters who would like to make a comment. So Rick, if you could please unmute yourself and tell us where you are from and ask your question or make your comment.
Yeah, thank you. It's actually Rick and Elizabeth Peters. This is Elizabeth Peters. I appreciate the opportunity to come on. And I want to thank you for serving the people of Clackamas County. I can only imagine what you all are going through. This is such a difficult time. My husband and I are owners of a small family business in Wilsonville, and our business was hit very hard by the governor's closures, and we're pivoting as quickly as we can to offer additional services. We take seriously the charge to do our part in mitigating the spread of COVID, and we've encouraged others to do the same. We're very careful to mask up, wash our hands, and stay home as much as possible. But my primary concern through the pandemic is the shift in personal responsibility and what we are allowing our governor to control. So prior to Thanksgiving, Governor Brown told Oregonians to call the police if we knew a neighbor was breaking the governor's guidelines for group sizes in their home. This statement was incredibly disrespectful of constituents. It puts neighbors in positions of being watchdogs over neighbors. I have never and will never call the police on my neighbors, and I trust that you would not either. So within a span of months, we have relinquished our local control, not only of the rights of businesses to operate, but personal rights within our own homes to one central elected official. I'm very concerned about this, and I hope you are too. Our rights to life, liberty, and the pursuit of happiness have been compromised. So here's my question. During the pandemic, What are you doing as a leadership team to protect Clackamas County citizens' rights to life, liberty, and the pursuit of happiness? I really appreciate you letting me ask this question, and I'm eager for your answer. And again, thank you for your service.
Well, I think, yeah, that's a tough question. We do everything we can to protect the lives of all our residents. And while it may seem unfair, we certainly look to our professionals, to the state of Oregon and various health departments to follow the rules that they say save the most lives. And that's all we can do. The governor has rights by law to tell us in an emergency situation like this, a pandemic, what we can and can't do. So we have very little flexibility to do that. All we can do, I mean, I have personally visited sites, talked to the governor about them, a bowling alley, for example. The governor has made changes based on what we said. The three chairs of Washington, Multnomah, and Clackamas County, we talked to the governor, and governor's staff often take what we say, whether verbally or in writing, and make adjustments. But we're still limited to what her professional advisors tell her is the right way to do it. And all I can say is, you know, if we hadn't done this and the death count was in the thousands, everyone would be blaming her for not doing it. The death count is under 1,000, I think, and a little over 1,000. I'm looking at Dr. Preston. A little over 1,000. And a lot of lives have been saved because people have followed the rules. And you could see it all the time. People who don't end up, I mean, Giuliani, the meeting he went to, 30 people left infected by the virus because he insisted that some people not wear a mask. So what can I say?
Yeah, I understand that. It's that point where the governor asks us to call the police on our neighbors. To me, that is overreach.
I don't disagree with that. I mean, we all have to take our own responsibility for how we, protect others. And if, I guess if it's your decision to go to that person's home or not. But I have given up a lot this year, as we all have. And I got to tell you, I'm glad I retired from my business because I don't think I would have survived. I don't know how you guys are doing it.
Well, thank you. We've had to pivot quite a bit, so appreciate your answer.
Well, thank you.
Okay, we now have another question from Sam. Sam Allen, if you could unmute yourself and tell us where you're from and ask your question or make your comment. Sam, it looks like you're still muted. The mute button could be at the bottom of your Zoom bar. All right, Sam, we'll come back to you. Oh, are you there, Sam? All right, Sam, we'll come back to you. We will go ahead and move on to Dirk. Dirk, if you can unmute yourself and ask your question.
Yes, hello, can you hear me?
Yes.
Okay, great start. Okay, hello, Chair Bernard, commissioners, and other dignified attendees. I don't recognize all of you, so I apologize for that. My question, I don't even know if it's really a good question for you guys or who we need to talk to about this, but one of the problems I see with coming out of the whole coronavirus epidemic, pandemic, whatever you want to call it, is the whole people are getting themselves into with their forbearance on their rents and mortgages. They're not getting evicted now, but eventually these the back rent is going to become due, and they're not working, and the money that they're getting is definitely not going to be enough to be able to save up to pay those things off later. And it just feels like we're going to have a really huge problem with a lot of people. It sounds like they're going to get evicted or foreclosed, or I'm not even sure what's going to happen. And I know the county can't solve those problems. I know the city can't. I don't even know if we can on the state level, but has any thought been put into that? Any kind of brainstorming going on and on what we can do? Obviously, property owners have the rights to get their rent, and if they don't get paid, you can't let the people, necessarily stay. Or anyway, it's extremely complicated. I just wanted to see what your all opinion is on that, and that's the end of my question. Thank you.
We are definitely talking about it. It's scary. It's really scary. In January, I believe, this expires. I know that governor, the federal government, the state government, various counties who got CARES money are looking at how we're going to get past this. It is very scary. I don't know how we're going to do it, but we need the federal government to step up, and hopefully they're working on something now. Paul, did you want to say something?
Yeah, you just covered on the last portion, and that is, I think we're all kind of waiting to see what the federal government does and the state government does with regards to helping prevent that from happening, or giving the financial assistance not only to the people that are, renting, but also to the property owners or the landlords, if you will, to help cover their costs as well. So, we've been asking for both. Because they all have bills too, and so we're very concerned. And it's not just an Oregon problem; this is a nationwide challenge as well. So stay tuned. We're hoping that something goes through the Congress and something in the U.S. Senate that gets passed and signed by the president to get some assistance before the end of the year.
And I'd like to add to that a little bit. I was on a national call today with the National Association of Counties, and it was our large urban county caucus and our rural action caucus. And all of us, rural, urban, suburban, are facing the same problem nationally when it comes to evictions and it comes to landlord issues. So that at the national level, not only here at the local level, we are lobbying very hard to get Congress to release additional CARES funding with the aim of not only stopping evictions, but also giving relief to landlords. That was a very loud and clear message that we got today. So it's not only our county, it's the over 1,000 counties in the United States who are working on this issue together.
Excellent.
Thank you.
Thank you, Doris.
Thank you very much.
We will try Sam again. Sam, if you could unmute yourself and ask your question, and then we'll take another email that we received. Sam?
Still can't hear him.
Yeah, Sam, we're having a hard time hearing you. And it looks like you are unmuted, so we will keep trying again. All right. So why don't we go ahead and take an email. We have something from Robert Denigan from Milwaukee, and he has a twofold question. So he writes, many other areas in the US have reopened schools and have experienced few or no cases of COVID-19, particularly among the younger children and lower grades. Also, there have been no teachers that I'm aware of who've caught COVID from their students. Is this true? If so, why aren't our schools open? Why is the almighty teachers union against opening schools? We need to do what's best for our kids, and open schools with kids in classrooms is best for them. Having kids at home is also hard for them and their parents emotionally, financially, physically, and psychologically, as well as educationally. We need to go beyond this.
Well, Dr. President might want to answer some of this, but one thing is we were just about to open schools when this surge came. We were close. Sarah, Dr. President?
Yeah, thank you. The schools, especially elementary schools, is something that is top of my mind the majority of the time. I think that getting our children back in school has there's so many important personal health, mental health, behavioral health, the family's health. I really think that getting kids back in school is a top priority. I want to give a little bit of perspective on this in that when COVID-19 hit, we had plans for pandemic influenza. We know that influenza spreads rapidly amongst children, and that closing schools was an important first step to prevent spread across populations, as it would be for a novel pandemic influenza virus. We've learned so much about the coronavirus disease in the last 9-10 months, and we realize that it's different than influenza. It tends not to infect children because of various biological factors. And children tend to have less severe disease when they get it, and they tend not to spread it as much. There have been many other states and other countries that have successfully had schools open with limited transmission. That's not to say that there's no transmission. And we need to really understand that schools I believe there are ways that we are really focused on trying to figure out and be creative with, that schools can implement safety precautions that we can get our kids back in school as soon as possible. Right now, with the surge that we are having and our hospitals being strained, we need to remember that schools have many adults in their populations as well. There are teachers, there are staff, there's janitorial staff, administrative staff. And what we're finding in places that do have some on-site learning is that there are enough cases that lead to the need to quarantine that ongoing education gets chopped up, right? So you may be in school or have education for a few days. Somebody comes down with COVID-19 and everybody needs to quarantine for 14 days. So really that back and forth is also a risk that we really need to balance. I know I'm going on and on, but it is a complicated topic. Yes, we think that children are at less risk of getting and transmitting it, but we need to think about the staff in the schools. We need to think about interruptions in education and that effect. And we need to think about it in the setting of this current surge. But it is a priority. It's just not something that is considered safe right now in our community.
Chair Bernard, you're still muted.
Okay.
I'm not really, I'm talking to somebody else.
Well, I wanted to just comment that we have to remind people that as a board of county commissioners, we don't have direct control over school openings. That really isn't part of what we do. I would like to comment on what Dr. Present said. I have grandchildren in England. They have opened their schools, but just as Dr. Present said, my younger granddaughter, they had a few cases in her class and it was a chopped up issue where they have to come in and they have to come out. And it's not, perhaps maybe children don't seem to get it, but they do. And it is risky for teachers. So I think we need to join forces for creative solutions of how we can manage this. And I know that Commissioner Fisher and I have been talking about this issue because we've heard directly from parents about how difficult and hard it is to have small young children at home. Similar situation with my daughter, who has a 1-year-old and has been in and out. If he gets a runny nose or a fever, he's got to quarantine for 2 weeks. And they are there at home with a little guy running around, and it's very difficult for them. They're lucky they have their jobs and they're able to do it, however. But I think for many other people, it's even far more difficult than that. So it's a conundrum. I hope we can come up with something. I know that we're interested in having open-ended conversations with our education service district, as well as the school superintendents and the school boards. But they are really the area where the final decision is being made based on the metrics that they're getting from the state.
Thank you for that. And thank you for the patience for everybody who has their hands up. We will next turn to Lisa. Lisa, if you could please unmute yourself and tell us where you're from and ask your question or give your comment.
I am from Lake Oswego. I'm a long-term resident of Lake Oswego and a native Portlander. So you'll have to bear with me. I'm a little bit nervous. This is the first time I've attended a county meeting. However, I have several questions that I would like to present to the doctor. So as Mr. Bernard had stated, we were close to reopening. So I would like to know, since we were close to reopening, in the phase metrics that we were originally using with the state, what prompted the new metric change to follow schools? That's one question.
So if I'm understanding correctly, what we're close to reopening schools is what his comment was. At that, the school metrics are separate from the other sort of business opening metrics. The school metrics had recently been adjusted to be, we thought, more attainable. The case rates could be higher than they were previously based on new evidence. Oregon was one of the first states to put out metrics for schools, and they were very conservative. They did loosen, and we quickly reached over those even loosened metrics for school reopening. So we were close. The metrics made it more attainable to get in-person school, but we are still having too high of case rates. The phased reopening has to do with phase 1, 2, or 3. Phase 3 was not expected until vaccine or the sort of going back to fully normal as far as non-school endeavors, other businesses. Having it be the metrics that we were looking at and the sector-specific things that were mandated, given increased understanding of the spread of disease, increased understanding of the risks and how different sectors could mitigate or not the risks, it really became clear, in my understanding, to Oregon Health Authority and the governor's office that going by risk rather than certain metric trends was just, it made more sense and it made it more consistent. And it also was really based more on the science of where we're knowing the risks. I don't know that that's a very clear answer, but as far as changing the phased reopening to risk-based, that really was a decision of the governor's office based on trying to follow the metrics that mean the most as far as public health.
I think also it was an effort to, we have some counties that are doing really well and some counties that aren't, and just a statewide mandate. Some counties found that very difficult to deal with. So while some counties may have schools that are partially open because of the cases in Clackamas County, we have been able to do that. Now that they're tied, I'd say it's going to be more challenging, but we'll see. Was there an additional part to that question, Kimberly?
I believe Lisa said she had a few questions.
Yes.
Okay, go ahead.
I have additional questions. So I would like to know, because this is very interesting that we've been closed for 9 months now, And the schools on January 6th will be closed for 300 days, I believe. And so we are suffering, many people are suffering, and the governor seems to have carte blanche on what she dictates for the whole state. Now, I know that the last I heard that there are 37 counties in the state of Oregon that are this extreme cases. So I just have a couple additional questions. So as testing has increased, the number of cases has increased. So wouldn't that be, that's just a comment. So I would like to know what the statistical metrics are in Clackamas County for the flu, your regular flu, a cold, and COVID, and has the county, the state, or any government entity been tracking these numbers?
Mr. Chairman, can I respond to one part of that?
Sure can.
Repeatedly, I've heard people make the comment that as testing increases, the number of cases increases. That is not the case. As testing increases, we know about the cases that are out there. There's a qualitative difference in that. If we don't do testing, we have no idea how many are out there. And the more testing we do, the more accurate the number is. I just wish people would phrase that a little more carefully, because it doesn't mean cases are going up. It means that we know about more cases. Thank you.
I would like to comment on the flu metrics, or the flu following. Yes, and I agree so much. Thank you, Commissioner Hummerston. That it is more accurately getting the cases, but we are also seeing increased illness in the hospitals, increased deaths. The rate of increase is not explained by testing. The increase in testing will help identify more cases and help prevent spread, because the sooner you can identify them, the sooner we can control it. But that is not the only reason that our cases are going up. As far as monitoring the numbers, so Clackamas County, you can look at blueprintclackamas.com and find a data dashboard for Clackamas County specific data that we're tracking. You can also see Multnomah, Washington, and Yamhill counties there. As far as flu rates, our Oregon Health Authority monitors the flu activity every year. My update as of yesterday showed that that flu activity remains low, both locally and nationally. Test positivity for flu is at 0.2%, and there's both flu A and flu B, but very minimal flu activity. So Oregon Health Authority for many years follows the influenza activity starting about October. There are sentinel sites so hospitals and outpatients throughout the state that will test for flu, sort of more of a random sample, so that we can keep an eye on what flu is doing. And we're closely monitoring those numbers and how they may correlate to COVID-19 numbers. And if you're interested, you can look at flubites.com. I think flubites.com from Oregon Health Authority will tell you influenza stats from Oregon.
Did you have another question?
I do have another question.
Go ahead.
Could you tell me what the death rate for Clackamas County was last year?
For the flu, I assume.
No, for the total number of deaths last year in Clackamas County.
I don't have that number right now. I don't have that number right now. I can say that Oregon's death rate from COVID-19 is, the last I saw was about 1.4%, which is well below our national average of about 2%. Influenza mortality rate is much lower than that, usually more under 1%. And from what I've seen, there's been approximately 4 times the death rate for COVID that there is of our regular flu, but I don't have the Clackamas specific numbers on that, Lisa.
Well, I think she was asking how many people died last year. Yeah, we don't have that.
That is correct. So my last question is the whole state, the entire state, using the same testing kits or the same type of testing for all the COVID tests that are being done in the state? One test type of test, because I know there are multiple out there. Is the state
Yeah.
using one test?
No, there are multiple COVID-19 viral PCR and antigen tests that have emergency use authorization for testing for COVID-19 disease. Multiple different tests exist, and multiple different tests are being used throughout Oregon in different healthcare settings.
And one other thing, there are 36 counties in the state, and last I heard, like 27 or 29 were in the high risk, and the others are at various levels. Paul, did you want to add something?
Yeah, I guess, yes, I do. I want to just share with Lisa, thank you for your comments, and with those in the audience, that at our 10 o'clock business meeting today, we had our COVID update. And in that discussion, we discussed and talked about, the metrics. And we have been, I think, constructively trying to scrutinize the metrics and which metrics to look at and to consider. So the metric, I think, that is driving us, and from the beginning, I think, and the governor, is really the hospitalizations and the hospital capacity and the limits on that and the pressure that's being put on that. And we don't have that graph. I wish we did at this moment, and maybe someone can forward that and just post that for everyone to see. But the hospitalizations have spiked considerably, and the load on our hospitals and ability to serve other people. There are now surgeries and hospitalizations for non-COVID things that are being canceled, delayed, and postponed because of the stress right now in the system. So when you look at the mortality rate, if you look at it nationwide, you can find that on the CDC right now, you'll find that we're already above the 2019 death rate of 2,800,000 people for all the various reasons. We're 3 million something, and that's largely attributed, that increase or change is largely attributed to COVID. But the interesting thing that you'll find right now, what puts Oregon in a unique, precarious position, is that if you look at the hospital beds per capita, hospital capacity per capita of all the states in the country, Oregon, unfortunately, has the lowest per capita rate. It's 1.6. So that 1.6 rate of hospitals is the lowest in the nation. California is not close behind, as well as Washington. So the West Coast states, for some reason, have very low hospital capacity. It's not all about the size of the state. Montana, for example, has twice the hospital bed capacity per capita than we do here in Oregon. And the East Coast, there are states that have 3 times the hospital capacity. So that puts us in a tough spot. And I have a friend of mine that already has had operation postponed because of COVID early on, rescheduled, and just got postponed again because of this outbreak. So it's this surge in the outbreak. So it's that I think is what compels us to take, and should compel all of us to really pay close attention to this, let alone the fact that people are literally dying. And if you just look at the recent death rate per day, we're in the 20-30 numbers per day recently. So that's something we need to take seriously. Thank you.
Thank you, Lisa. We'll now move over to B. Castor. Thank you for your patience. Could you please unmute yourself and tell us where you are from, and ask your question or make your comment to the commissioners?
Hi, this is Barbara Castor. I am in Oregon City, and my question would also relate to cases. This is probably for Dr. Preston. Given that we use different tests throughout Oregon, but a great deal of them are the PCR test, there has been quite a bit of research about these tests and information available, and it has to do with the cycle threshold count. And according to Patrick Allen of the OHA, the common number that's being used in Oregon is a cycle threshold count of 42. Now, there's quite a bit of information out there. There have been quotes by several scientists and doctors saying that any cycle threshold count above 35 is non-infectious, including Dr. Fauci. So my question is, when we're basing all of our metrics on these cases that are determined by a PCR test, shouldn't we have an awareness of what that cycle threshold count is? Because if we're determining cases for these metrics that are closing schools, businesses, limiting gatherings, we should know whether or not these people are infectious, or if we're just capturing sort of a remnant from them being sick prior, or there's not enough virus there to actually make them symptomatic, infectious, and all of that. Can you speak to that?
Yes, I can. I don't think anybody else here wants to talk about cycle or knows about cycle thresholds. I thank you for that question. That's a very interesting one. The cycle threshold is based on the test itself. So each emergency use authorization for a particular test and the developer of that test sets the cycle threshold for the positive or negative. So it may differ across different tests based on brand. It doesn't differ much. You're right. It's in the upper 30 to lower 40 area. But that is set by the test, not by public health policy. However, we do know that many people can continue to test positive on PCR past the point that they are considered infectious. We have been pushing to ensure that people use the time-based release from isolation. So if you have COVID-19 illness, you isolate for 10 days from the beginning of your symptoms. And as long as you have 24 hours fever-free without fever-reducing medicines and all their symptoms are improving. We know that people who are tested by PCR past that time can have what we consider to be dead viral particles picked up on those tests. This is also part of why we really discourage any businesses or employers to require a negative test for people to come back to work, because it may be that they are testing positive when they are no longer infectious. At the same time, the disease is widespread enough that if you do have a positive test, if you don't have symptoms, we assume that that positive test is the beginning of your isolation period because it's really the best that we have. And it is really considered a positive or a negative based on the manufacturer and the set point that is set for positives.
Okay, I hear what you're saying and I follow. I've got probably 3 issues with that. I'm not a medical professional, but I've spent a great deal of time researching this, and I've talked to some people with better understanding of the tests and the science than myself. I'm also following court cases and changes in policy in other states. For example, now in Florida, they're going to require that labs disclose what that cycle threshold is. Because what we see are a lot of cases that, for example, even in Oregon, when they went into Pacific Seafood and they tested all of those people, and they had a very high rate of asymptomatic people. So it doesn't take a scientist or a doctor to do the logic on that and say, maybe we're capturing a lot of people who, like you say, have a small amount of virus left over from a prior illness, or maybe they were mildly ill or asymptomatically ill, but they're not infectious. And so we're asking these people to stay home and quarantine, and then we're contact tracing them. And we're asking those people to either quarantine, stay home, get tested. And so it goes. So do you see the problem there? That if we're basing things on cases on a test that may be capturing a large number of people who are non-infectious, and we're basing public health policy on it, that seems pretty risky to the side of harming businesses, kids, going to school and activities. If you're going to do a mass testing program, people should know that they're not just a positive and they're staying home just in case. They're staying home to actually protect their community, protect their neighbors. And if you multiply this out into the numbers that we're starting to test, because in the last couple of weeks, Oregon's testing has increased drastically. So the more tests we do, the more problems we could be creating under that scenario. The other thing is that if we test somebody, say a professional athlete, and there's a high motivation there to get that person playing, so they get a second or a third test, and then they're, free to go play, but your average person gets one test. And so when you see that there are, I don't want to mislabel them a false positive if they're capturing, a little bit of virus from a past infection. That's not technically a false positive. That's just no longer infectious. But if we're not testing people multiple times to prove that they are really an infectious person, but we're asking them, to perhaps do things that cause harm in their lives, I think we need to look at that. And there should be some pushback from the county to the health authority to this is impacting a lot of people. And if, as we get to after the first year, say we do look at opening schools, and if testing is going to be a part of that metric, this problem is going to continue. And the other piece is that there's some evidence that if you capture somebody at a lower cycle threshold, say around 20, that their viral load is high enough that that person might need immediate medical attention. That's just one study that I read. And so if we're using a high number and everybody that tests positive is kind of considered the same, go home, see how you do. Maybe if you develop symptoms, you go to a doctor. But if we used a different way of testing, focusing on people who had symptoms or were ill or were high risk, we could be missing people that are seriously ill and sending them home without treatment from these testing centers. Thank you.
Thank you so much, Barbara, for your concern and your questions. I can certainly take the questions about the cycle threshold to our Oregon State Public Health Lab. Again, that is set by the test, and there are many different tests. I also know that the increased rates of disease decreases our false positivity rate. With any test, there are risks of false positives and false negatives that we have to consider. We do encourage providers who have limited testing capacity to focus testing on those who are at high risk of having disease. That would be people with symptoms and close contacts that we know are at high risk of getting the disease. And we also, there are challenges with many different types of tests, including all the ones for COVID-19. And as we learn more about the pros and cons of the different testing options. And we will take your considerations into our countywide testing strategy that we continually are working on. Thank you.
Thank you, Dr. President. We have another email question related to testing. So, and you may be the most appropriate person to answer this. The question, I'm sorry, Commissioner.
Yes, I'm just going to have to let folks know I have another meeting I have to be at 4:30. I will continue to listen to this as I travel, but I just wanted to make folks aware I have another piece I have to go to, and I think you guys are going to go for another half hour or so. Okay, thank you, everyone. I'm glad I could be here for at least the first hour. Thanks.
Thank you, Commissioner. Okay, so Angela Kirkpatrick writes, I was wondering what the status on how readily available COVID-19 tests were if we need one. Is using a rapid test available to everyone? Where are drive-through testing facilities in our county? I had a hard time getting a test when I needed one, and was told I couldn't get a rapid test. Reopening is likely going to lead to a need for increased testing. Can our county support that?
Our Clackamas County Public Health Division does not have our own direct services. We do some outreach testing for specific high-risk populations through contracts that we have, but testing really is available through your healthcare provider. There is ongoing conversations amongst the healthcare systems in our region about testing availability, and you can find the most up-to-date testing options on our website under the testing tab at clackamas.us/coronavirus. The different types of test and where you can get it is somewhat dependent on which insurance you have and who your healthcare provider is, but there is plenty of testing in Clackamas County right now.
Thank you, Dr. President. And again, that website was clackamas.us/coronavirus/testing to learn more about the testing in Clackamas County, and especially what to do after you have been tested for COVID-19. Okay, we can get to a few other questions here by email. And again, to those who are joining us today, if you want to use the raise your hand feature on Zoom. Let's see. Okay, here's another one. This is from Conrad Rasmussen, and he writes, can you please refer me to guidelines for the best practices for in-home care for COVID patients? I could not find a guide online to print out and read and plan with. It is critical that elderly citizens like me living in my home with a retired spouse can read up and plan ahead. A newsprint guide by mail to each county household would be very timely and helpful too. Thank you for your help and looking forward to your help.
We do have on our county website under the testing website that Kimberly just told us, an after you get tested guide. And that's not necessarily just for after you get tested. It has a lot about isolation and quarantine, what that means, how to care for yourself and how to care for others in your home. We are passing that to healthcare providers as well, and many of them may be able to give you a print option. So I would just refer you back to our website there.
And thank you for the email, Conrad. I see that you provided your address to us, and so we can actually get a copy of that in the mail to you if hard copy is going to meet your needs. So thank you for that email. We have another hand, and Sam Allen, again, if you could go ahead and unmute yourself and speak directly to the commissioners. Okay, you want to try this again, Sam? Just go ahead and hit the unmute button and that should open your mic. All right, we can circle back to you. We have a few more emails to come to. So we have one from Marina Gephardt, and she is writing on behalf of the Sandy Cinemas. And so, and the Sandy Cinemas writes, thank you for making this time to listen to businesses. My comment is on behalf of Sandy Cinema to simply share our perspective in the hopes that you will pass it to those higher up and the general public. Please, we beg of you to advocate for movie theaters reopening safely. We at Sandy Cinema have been forced to close since March. All but a few of our local employees have been laid off and only work a few hours on Fridays and Saturdays to serve curbside concessions, which is essentially a community service since we don't make a profit from this practice. Movie theaters have not been given the opportunity to open safely as restaurants, bowling alleys, gyms, bars, etc. have been given. We are going above and beyond at our two other small locations in regards to safety protocols. We follow to a T all local and CDC guidelines and have also voluntarily complied with complied, with an industry-wide epidemiologist developed national protocol called Cinema Safe. Nowhere in the world has one COVID case been traced to a movie theater, even in instances where somebody with COVID inadvertently attended a movie while infected. Well, we want to make clear that we respect all safety guidelines and actions, and our staff and customer safety is always at the very top of our priority list. However, movie theaters are being unfairly excluded, in particular in reopening efforts. Additionally, as of December 3rd, Governor Brown has added new restrictions for theaters whenever we are allowed to reopen. We are not allowed to serve concessions inside, and customers are not allowed to eat and drink. Meanwhile, restaurants open and are allowed to participate in this practice. Concession sales is our main revenue source. It's hard to see the logic in reopening at all at this point. Our communities cannot afford to lose social, economic, and cultural values that theaters provide. 268 million people in North America went to the movies last year to laugh, cry, dream, and be moved together. We can do this safely, just like restaurants, shopping malls, gyms, grocery stores, and every other business type. Moviegoing is one of the most affordable out-of-home entertainment options, and we cannot let our beloved cinemas disappear. Thank you for your time, Marina Gephardt. So thank you for your comment, Marina. Okay, so again, we'll try Sam one more time. Sam, if you could try to unmute yourself. And you are unmuted on our end. Okay.
Sam, if you're on a computer, you may have your mic off on the keyboard, which I believe F3, and that's a speaker. Looks like F4. Try hitting F4. Sam? I hear some noise.
That could be me.
Oh.
All right.
Okay.
Thank you, Thank you, Chair Bernard. Okay, we have a few other emails. And this one is actually coming in from a foster parent. And then she writes, my question is foster care. And this is Deborah Hodges, by the way. She's like, as a foster parent, I witnessed the negligence of the state to care for their children during this pandemic. They're not giving foster homes to support the need to help the children. And I challenge the state and the work they do as it relates to foster children. Are we going back to hotel and children? Okay, and again, if you have a question that you would like to share with the commissioners, please use the raise your hand feature.
Really, I do want to just comment that I don't know that I can really comment on DHS and all of the policies around foster care right now. I know that there are many communities really hardly hit by this, hit hard by this pandemic. Resources, we do have a page. You can Google Clackamas COVID resources. You can go to clackamas.us/coronavirus and look at our resource page and find assistance for many things, including calling 211 can also help a lot.
Great.
Yeah, and I just want to add that if there's ever a concern that a child is being abused, even if they are a foster child, or that the state, I would report that to the hotline and just make sure we all are extra careful in taking care of our children. We don't have the eyes and ears on children like we had when they were in school, and also even doctor's appointments are less, so we don't have those professionals that have their eyes on children. So we as community members, whenever there's a concern, really important to report that concern. So thank you.
Nicole has her hand raised. So Nicole, if you could please unmute yourself and tell us where you're from and ask your questions.
Hi, I'm from Happy Valley, and I was just wondering if, so I have two kids, and one of them does dance, and the other one was trying to do basketball. And both of the places that they have done a really good job with maintaining cleanliness, wearing masks and sanitizing. There have been no cases amongst any of those. It was really nice to get the kids back to getting them out of the house, because at least they don't have school, but at least they could do some activities. And I would love for Governor Brown to be able to have them reinstate their activities again. I don't know if you guys can push for that. I don't see why they were shut down, the dance studios, the basketball. I mean, all that they were doing for basketball was running drills. They weren't doing any actual playing, but it was the I-9 sports. And I would just love for them to be able to get back to their activities, to give them something to do outside of the house, because they are literally in the house all day long with nothing except, their school online.
I mean, I think that we all feel the same way. I don't know why specifically those kind of things were postponed or canceled for now, but we will definitely pass the word on. Thank you.
Thank you very much.
We also received another question about dance classes, and I'll read it very quick. This is from Tracy, and Tracy writes, "Good afternoon. I have one child that has a Zoom dance at her dance studio and one child that gets to go into the gym to play club volleyball. My question is, why isn't doing dance at dance studios considered a youth enrichment program? And who and how do they determine this?" And hoping for some clarification. Thank you so much, Tracy. So thank you for your comment, Tracy. It's on a lot of people's minds. So we have one more question, and we'll take it here. And this question also comes through by email. Let's see, I'll pull it up here. Okay, hang on a moment. Apologies. There's too many. I have too many emails. Okay. The question writes, it's actually a statement, and this is from, and a question, and it's from Barbara Cervantes Gattucci. And she writes, "Dear County Commissioners, I'm very concerned about the coming year with Tootie Smith at the helm because she openly flouts COVID-19 guidance. How will you be able to keep her in line? Our neighbor recently died of COVID-19 right after Smith's announcement about her big Thanksgiving dinner. Thank you very much."
Well, Ken and I won't be here. I'm sure that, Sonia, Paul, and Martha have lived through 9 months of this. They know the risks, they understand it, and they'll be here in the future to make sure that you stay safe. Remember, the chair of the commission is only one person. It takes three to tango, I've always said, to really, do some of those changes. I mean, to disobey the governor it would be a huge mistake. A lot of our funding depends on grants from the state, and that would be a big mistake. But we have some people here who have very well experienced with this terrible pandemic, and will do all they can, along with Dr. President Nancy Bush and Philip, to keep you safe, give you the information you need to keep you safe. but really it's up to your neighbors and your friends to also take precautions and make sure that they keep you safe. Did anyone in the future commission wish to respond?
Yeah, I'll just make a couple of comments. I really appreciate this listening session and I appreciate all the comments. And we are your commissioners and we are accountable to you, the people of Clackamas County. So continue to engage with us, continue to reach out, continue to connect when we have these opportunities, come to our business meetings. Let us know how you're feeling. We do listen and we read your concerns. We take those concerns to whether it's our state legislators, whether it's the governor, whether it's other commissioners around the state. And we are all in this together. So, and as a board, this current board has spent a lot of time working together, really trying to promote a team holding each other accountable, which we have done as a board. And we will see how the new board operates, but we need to be in partnership with the people of our community and really appreciate everyone's comments. We represent everyone in Clackamas County, not a political perspective or a political agenda. And our goal is to keep people as safe as possible, because when disease is running rampant through a community, the economy, and all of us suffer immensely. So it's striking that balance, and that's what we will do our very best to do for all of you.
Mr. Chairman, may I make a comment?
Sure, and then Paul, I think, wants to say something. Go ahead.
I just wanted to comment that one of the aspects of serving in public office that people may not be aware of is that our authority is pretty constrained by the law. And if we exercise authority that we do not have, in other words, step outside the bounds of our authority as individual commissioners or as a commission, we do not receive any protection under the law. We would have to defend ourselves in court at our own expense. So that those boundaries help keep elected officials in line as they should be. I will not step outside the bounds of the authority that I was given as a commissioner, and I know my fellow commissioners won't do so either, because nobody wants to put their house at risk, to be quite candid. So, you know, obviously we hope that people will behave ethically and morally without the threat of a lawsuit, but it does exist, it is there, and if we misbehave, we can and will be held accountable.
Paul?
Yeah, I'm gonna come at this at a different angle. I think when people run for office and then they soon discover after they're appointed, not appointed, but sworn in, that, you know, there's varying different amounts of responsibility that comes with that. And one unique thing about the state of Oregon and counties is that we are the Public Board of Health. It's one of the hats we wear. And there is specific language in there that really makes us accountable. And it's a significant amount of responsibility that we have to protect the health of our constituents. So I don't take any of that lightly, and I would encourage anyone to just look up and look at that language. And so therefore, I guess in another way of saying it is that for people that do not have that responsibility, it's much easier to maybe to make statements and not have to either be aware or understand of that role of responsibility. So it is very frustrating. What I really wanted to say, this is a very frustrating situation, because when we have that responsibility for the health and welfare of our constituents as defined in our ordinance and in the Board of Health role, but yet not have the controls, if you will, which are set by the state, it really is an untenable position. It's even holding this town hall webinar here that we're doing today. we're responding, and your questions are directed really at things that have come downstream from the state to us that we are forced to implement. So the frustrating, untenable piece of that is that while we can suggest the changes, and we have, I've actually written to the governor, never got a response. We have voiced our concern. We've been part of many discussions with other county commissioners and in virtual meetings and other elected officials around the state, city councilors, state legislators, trying to get, some adjustments on this. And when the hospital bed capacity was much lower due to COVID, far lower, it was easier to make those arguments. But right now, with the spike in the cases, and most specifically, I'll say it again, I said it earlier, with the spike in the hospitalization beds being occupied and that cushion getting smaller and smaller, and now essential surgeries for people, normal surgeries are being postponed, that puts us at really, really high risk. So as a community, us looking out for others, whether we are in great health and our neighbors are not or whatnot, I think we just need to come together and realize that, the enemy is COVID. And we just got to keep in mind that we ought to just try to pull together as best as possible. And as the doctor said earlier, we're going to get through this. The sooner the better. The vaccine is going to be out there, and we're going to get past this. And I, as a small business owner my entire life, do I understand the impacts and how difficult it is to run a business? Absolutely. I spent most of my adult life doing that here in Clackamas County over 25 years. So I've never been through what you're all going through. For those of you who are businesses, I didn't experience a virus like this with the shutdown, but I can certainly empathize on what that means with your business, because I had very tough times. And I won't get into any graphic detail about how difficult that was, but I was able to make it through, and I hope the best that we'll all make it through. And I wish you all the best. We're going to do our best to get those CARES Act dollars out to you. If you have any questions about that, please reach out to us, Business and Community Services. It's listed on our website. And we're going to try to do everything we can within our legal power. Thank you.
I see that we're nearing 4:30, so if any commissioner has any parting words, now is the time.
Well, I think this is my last town hall before I leave. Ken and I are leaving. And I want to thank staff. I want to thank Dr. President and all the people who've done the hard work to keep this county going. I said one time that this is my 20th year in politics, and I trained 19 years for this. And I'm still learning something every day. But I think we have a lot of heroic people out there who have gone way beyond what they ever thought they would have had to do to keep people safe. And I want to thank everybody in the county for your support and for caring enough about each other to wear a mask and stay home when you're sick. We've got a ways to go. And I look forward to working with you all in some capacity someday in the future. Thank you. Ken?
Well, you pretty much said it all, Jim. I agree with you. We have some extraordinarily dedicated and talented people that have been working through this COVID crisis and the fires crisis, as well as on all of the different projects that we were all involved in over the last 4 years. I want to say personally thank you to them for the work, and remind the general public that we have some really outstanding people who work for Clackamas County. You should be very proud of the quality of people and their dedication to this county. Thank you to my colleagues for the work that we've been able to do together. And as you said, Jim, please wear your mask, maintain your social distances, and minimize your contact with others so that we can get out of this as soon as possible. Thank you.
Okay, well, thank you all for your questions, and thank you, commissioners, for joining us today. We'll try to answer any remaining questions individually. And as a reminder, we'll hold another town hall via Zoom for people who speak Spanish next Monday, December 14th at 4 p.m. So thank you for joining us. Please stay safe and have a good evening.